Smoking for me started in high school. It was pretty cool to smoke. Then as I got older and started dating, the boys were smoking. And I think by the time I was about 19, I was probably smoking 26 a day. And that's pretty much what I continued doing for the next 20 or so years. I think like most people who smoke, you try to give up several times because you know it's bad for you, all of that kind of stuff. I remember one time I had to go into hospital for a knee operation and they told me that I had to give up smoking for a week beforehand. I remember that being one of the worst times ever and my moods were completely out of control that I ended up smoking again before I went in, for the operation because I just couldn't do it. So after that, I pretty much had decided that I was always going to smoke, that I simply couldn't give up. But my partner at the time said that he was going to give up smoking. He'd been to the doctor and got Champix. So that's when I started to seriously start thinking about giving up smoking. It just so happened at the same time that I was going under a health kick besides the smoking in an attempt to fall pregnant. So I was 40 at the time and this was my last time of trying to fall pregnant. And what happened was I fell pregnant, but then had a miscarriage. So for me, that was the defining moment of, I think if you really want to have a baby, then maybe giving up smoking is what you need to do. I didn't want to do the Champix tablets because of the wanting to fall pregnant, and neither did I want to do the nicotine patches. So I was left with the option of using Chewies. I started to do little things like if I was going to go and visit a girlfriend for coffee in the morning, I would leave my cigarettes at home. The more I did that, the triggers lessened, and the cravings lessened, and I felt gradually over time more and more in control. And I started to feel like I was gaining power. And then I relied on the Chewies a little bit more as a buffer, if you like, to help me just that little bit more with the cravings. I didn't see a doctor or anyone else. It was literally just working through the Quitline and the Chewies and, just progressing that way. And sometimes I would be crying on the phone to the Quitline, telling them how much I can't do this, that I'm not going to succeed. They were not patronising. They were very supportive. They were very understanding and also, made me feel better about feeling so scared. As we grow, we develop our own coping strategies and it's based around a risk and resiliency framework. And part of a smoker's resiliency framework is smoking. So when you remove that, you increase their vulnerability as a person. And all of a sudden, they've had no prior experience to coping with a vulnerability that they previously had a strategy for. So part of you have to develop your own strategies now for feeling vulnerable when you don't even know why you're vulnerable. So for me, I used to smoke, go having a cup of coffee at work and a work break, but all of a sudden I'm feeling vulnerable now because I don't have an outlet. So you then start to feel emotions and then become psychologically vulnerable. So, and they can be a separate side effect. So it's good to talk to a professional about those things. It's not easy, and I don't think people should expect it to be easy. I think they should expect it to be hard. But life's not easy. Well, it's been 9 years since I haven't had a cigarette, and there are definitely times where I just think it's a perfect moment for a cigarette. But it's all in your head. It's the actual situation we're enjoying. It's not the cigarette. I feel like somebody who has just achieved something and just went from one part of life's journey onto the next.